The interesting thing is that primary and secondary trauma have the exact same symptom cluster. So you can end up as a person who experiences direct trauma. That means that a traumatic thing happens to you. Or you could end up being a person who experiences indirect trauma. And the symptoms are the same for both. So you're going to have some symptoms that some are intrusive symptoms, some you will do some avoidant behavior in order to deal with the symptoms that you experience. You may have some negative thoughts, you may have some bad moods, and you also may have some reactive behaviors that you do as a result of the trauma. But essentially, you can be diagnosed with either of those, and because of the experience, whether you're experiencing it for yourself or someone else, is still the same very strong response to something that is usually very horrifying or awful. Stress is different. It's in response to just sometimes obscene pressures that we are under in life, whereas trauma is being exposed to an extreme adverse event. And so that's the primary difference between the two. So I still may have stress as a result of my trauma, but it is separate. What's interesting about first responders, and I think it's also what makes them sometimes downplay their own symptoms, it's that it does have a cumulative effect over time. So they will slowly but surely be absorbing trauma after trauma after trauma, and they'll think, I'm okay, I'm okay, I'm okay. And then all of a sudden it sort of passes this invisible line and they're not okay. Certainly they have a tendency to have a very stoic attitude. That's part of the cultures within first responder worlds. And they also have some usually pretty good training about dealing with traumatic stuff. But we're still human and we're still absorbing. And so for many people, there is going to be that, again, that invisible line. I will sometimes talk about the slow onset for a lot of these people. And they're very confused, like, how come now? How come that event? And I always tell them it's that little saying, the straw that breaks the camel's back, or death by 1,000 cuts, whichever analogy you like. It's that. It's like it isn't the first 999 cuts that, or the 1,000th cut doesn't kill you. It's the other 999. It's the cumulative effect of all of those, and that's what ends up creating sometimes what amounts to them being very surprised, like all of a sudden I'm not doing well and I can't really put my finger on it. And that isn't necessary for getting help. You don't have to be able to cite one specific horrible event. It's that you have this giant pile of horrible events you've dealt with. Generally, you would seek treatment for trauma the same way you would treatment for almost any other physical issues. So usually it's easiest to contact your insurance company to find out who's a provider. Some people will go through their primary care doctor who might give them a recommendation. But also, I think word of mouth is sometimes a good thing. You may know somebody who's already seeking treatment and they might have a recommendation for you for someone who works for them. There's a lot of different kinds of treatment out there. Most therapists are going to use a combination of those types of treatments. So many of the treatments for post-traumatic stress are what are called cognitive behavioral therapies, which includes EMDR is a CBT, so is prolonged exposure therapy or cognitive processing therapy, and there's also many others that are being studied that it's becoming clear that they are also useful. And I always tell people when they're seeking therapy, make sure that you feel like that therapist is a good fit for you, because therapy is a lot like picking a friend, truthfully. If you end up finding somebody you just feel like they really get you, then chances are that's a really good match. If you go to a therapist and you feel like, wow, this person just doesn't get it, then it's not a bad idea to just move on, find someone else until you do find that really good fit. When you have a family member with post-traumatic stress, it's very important that you get educated about the disorder too. That doesn't mean that the person with the disorder gets to be in charge of everything or that they get to make all the decisions. You still have to learn how to have good boundaries for yourself, keep yourself healthy. And so I think for a lot of people that means you really need to tap into your own support system when you're dealing with something this difficult. And then it isn't a bad idea to seek your own therapy, so you make sure that you're getting support while you are supporting this other person. There's the analogy they use in airport, an airplane, when they say, put your own mask on first. It's really important that you take care of yourself, because if you're in really good condition, then you are going to be more useful to your family member. If you neglect yourself, it's going to become very difficult.
you.